Hello everyone, welcome to my channel Study Nursing by Sense School. Today we are going to discuss about another nursing plan which is anxiety. Before I go ahead, please be aware that I've prepared a detailed nursing care plan which is named as Introduction to Nursing Care Plan in my channel. And once you have seen that video, I hope you will have an idea of how to prepare the nursing plans and what are the 5 steps involved in the designing of a nursing care plan. That being said, without much ado, I'll go to the next slide, which is nursing diagnosis. So, I have prepared a general anxiety care plan. As we all know, that anxiety, talking about fear and anxiety, it's a very generalized term, yet there are lots and lots of factors that contribute to anxiety in a patient. So make sure that you have the idea that this is a very, very individualized plan, and it's important that you bear that in mind and prepare the nursing care plan accordingly. But I've made sure I have given lots of points in this video so that you can pick up the appropriate one and implement it in your nursing care plan as well. So, that is our nursing diagnosis, anxiety related to the disease condition. Let's go to the assessment of the nursing care plan. We have the subjective data. In this case, when your patient has fear and anxiety, he or she may or may not tell you about it. All right. So, but don't worry. At the end of the this video, I have prepared a nursing care plan scenario so that you can have an idea of how you can expect a patient to be, speaking to you, or the patient's statement and how it would look like. So, in the subjective data, you may have your patient telling they are anxious, or they might not tell you. So, in case they might not tell you, don't worry, because we have the objective data. So, in the objective data, as a nurse, you are observing a whole lot of factors, including the nonverbal communication, and you would also identify what cause is it, what is because of what thing they are having the anxiety. So you are going to explore along with your patient about what caused this anxiety, or what is causing the anxiety. Is it an acute one or is it a chronic one? So it's important that we identify the cause of the anxiety. The second point is to rule out any existing condition. For instance, if your patient has a withdrawal symptom, alcoholic withdrawal symptoms, or any other condition such as asthma. So some in that condition, if the patient becomes stressful, they can have the asthmatic attack and subsequent events, right? So it's important that we rule out any existing conditions, and also assess the level of severity. So we as a nurses have some limitation compared to the mental health experts, yet depending on the policies of your organization, or depending on the scope that such tools are available to you, you can assess it. If those assessment skills are not available, then also you can, as an individual, say, all right, he or she is severely anxious, or I believe this person is kind of having mild anxiety, at present. So you basically assess the level and severity. Why is it important? Is because at the end of your nursing intervention, you will be able to pick this as an evidence of whether the outcome was positive or not. All right. The next point is to observe the behavior. This is also similar to what I have told you before. Your patient may or may not exhibit behaviors, and they can be the signs of anxiety, like nail biting, or frequently going to the toilet, or not having the attention when you speak with them, repeating the question again and again to get the clarity. So these behaviors can be the signs of anxiety. I hope it is clear until now. We'll move to monitoring. As nurses, we'll obviously monitor the vital signs and if they have anxiety and they are experiencing some chest discomfort or pain, as per the order we may do an ECG to investigate. So these are what I mean by the term observation. We can also monitor the patient throughout the nursing care plan for any progress. When I say progress, I also mean for any deterioration. All right, if the patient's anxiety is deteriorating into something else, is this patient having a phobia or a panic attack, so it's important that we progress that anxiety throughout. And the other point is something which I've told already, to rule out any existing condition, and if those conditions are existing, to treat it. For instance, if your patient has a cardiac issue and a stressful event has happened, so we monitor that heart functioning by taking an ECG or referring to a treadmill or having an echo done, etc. So this is, I'm not complicating it, but guiding you through simple things that might matter in your care plan. You may or may not add these points. All right. Moving on to the next slide, we have the goal. So goal is quite simple. Either you can write, my patient has reduced anxiety at the end of my shift, or you may also paraphrase it as, my patient remains safe and comfortable. This also is a goal. It shouldn't be like, when you have a problem, you write by the end of the shift they may not have problem. It might not be applicable, especially when your patient has chronic anxiety related to a terminal illness. It might not be always possible that you do some interventions and by the end of the shift, that patient who may or may not be having a good progress is going to be anxiety free. All right, so this is the goal, a sample goal I have given. Let's move to the favorite part of the nursing care plan, which is nursing intervention. I've given a couple of points, but it's totally up to you to come up with your own. So let's talk about the first point. It is to identify and remove the source. It is applicable when the patient tells you that this monitors are making him or her anxious. In that case, you can remove or reduce the sound of the monitor. If they are acrophobic and if their room is having a window that shows the buildings and the skies, you might consider removing or giving any other beds or the ward to the patient. um, these are some of the things that you could do. Another important point is to validate their feelings. Many a times we underestimate it, and in my career I've often seen people not validating their feelings, the patient's feelings, and that might have a negative outcome for your nursing interventions. When they say to you that, I'm worried about the hospitalization right now, you can validate by saying, I understand, I can see that you are much worried now that you're hospitalized. So you may not, it's not mandatory that you introduce any other things. In fact, you should not, but you're paraphrasing what your patient is saying, and then you're validating, you're supporting, thereby they feel that they are accepted and they do not have to have the stress of proving you what they mean. It's very important point. Let me know if you have experienced any of the scenarios like this, where the patient is saying to you something and you have seen or you have told some contradicting statements or sentences. So that's an important point. That being said, next point is reassurance and comforting. I'm not going to explain to it because I believe since you are watching this video, you are obviously a compassionate person. So that wouldn't be a point which is to be explained much. Communicate very clearly and simply. This is applicable when your patient is unaware of a procedure. He or she doesn't have the knowledge of what's going to be the next procedure. In that case, we communicate very clearly that these are the things you can expect, and make sure that you are not communicating in a very fast pace, or you are talking to them in the medical terminologies. That's also essential. And another point is to provide a calm and structured environment, making sure that it is not clumsy. It's filled with lots of complicated medical stuff. I know in some scenario we cannot, but if it is applicable, then you of course can consider this. The next intervention is to provide adequate rest hours. I would say, as an example, if your patient is in a mental health setting and has anxiety, what with the whatsoever reason, he or she might have continuous schedules for occupational therapy sessions, social worker sessions, or in the evenings they might have the outdoor games. So it's very essential that you consider and acknowledge and try to understand what they are into, and then provide the activities accordingly. And also it's essential to provide quiet times, depending on your organization. If there is any prayer rooms available or silent rooms available, you can consider suggesting them, or even going out with the family, at least to the premises of a hospital, to get some fresh air. Relaxation exercise, I would definitely consider preparing some of the videos regarding the exercises that we nurses can recommend to the patients. If not, you can check with others what are the permitted exercises. You can suggest them to bring down the anxiety, such as simple breathing exercises. The next one would be to explore any other supportive measures that includes providing a leave record or something, and appropriate referral, for instance, a mental health reference if it is applicable. um, I'm going to give you an example, a scenario. Let's see if you can relate to all of these points which I have discussed. The scenario states a 26-year-old Emily got admitted in your ward with the complaint of shortness of breath. She's asthmatic, and she tells you that she's worried about her unexpected event of hospitalization and possible challenges at work. So, when you have the scenario right away as a nursing student or as a nurse, you can come up with a couple of observation. First one is, I assume she is young in my perspective. So she's 26-year-old young adult, and she complains of shortness of breath. It might be because of the asthmatic attack she has had. So remember, asthma is a disorder which is closely associated with the stressful events as well. So that is a point to be noted. She is worried about the unexpected event of hospitalization. So imagine if she has had an event and she is again having an unexpected event, that can increase the anxiety, right? And also possible challenges at work. So it might be the monetary issues that she is having, or Emily could have challenges balancing her family. Any of those things can be of challenges. So with the scenario, I hope you might have come up with a couple of subjective, objective data when we talk about the nursing care plan. And assessment, in the subjective data, she tells you, I should have been more careful with my life. I have no idea how I ended up in the hospital. Can't even think of what will happen to my job. So as we discussed in the scenario, these are the statements that reveals she should have taken much steps in the life to prevent the asthmatic attack. She was may or may not have been aware how this happened, so that's an opportunity for health education. And she's worried about the job. All right. The objective data, you have taken the observations. It's very important to make sure this is not her baseline data. For instance, if you have a patient who is having existing asthma or cardiac disease, this might be normal for them. So please do not consider or write this is because of the anxiety that she is having. But in this scenario, I assume my patient is otherwise having normal vital signs, but at this time, it is a bit elevated. I have also written some of the points where I have observed in her behavior. I have also written what mood Emily is in. All right. Um, Going to the nursing diagnosis, it is fear and anxiety related to disease condition. I would not explain it because I've already done it in the introduction. The goal is my patient has reduced anxiety at the end of the shift, because this is not, this may or may not be something that I can take care of within the permitted hours of my shift, but this is what my goal is. Nursing intervention, I would not stress a lot, but feel free to take up and include in your care plan whatever is applicable. All right. So in the intervention, what I would personally do is to encourage her to reflect and share with you the things that she feels about the situation. And I would also make sure, this is important, that I validate by not contradicting but supporting her. I'd also inquire if we can provide any leave records so that this job is secured. And I'll also participate as a nurse in her medical management, that is preparing her for the x-ray or explaining to her what next can happen, and family support, which is once again essential, and making sure if she needs any medical aids. If, for instance, if she is somebody who has been using a walking aid, and it was because she didn't have uh, a working or functioning aid, that she fell and then she had an asthma attack, in that case I can consider liaising with the other support that I have at hospital in delivering that equipment to her, or helping her with the ways she could have it um, delivered at home or something like that. I would also ensure that she has enough idea of what her condition is. If not, I can provide the basic health education, or I can even refer her to the appropriate healthcare professional. I would also, depending on her culture, religion, background, recommend support such as spiritual support or mindfulness sessions, and motivate to identify any of the future events so that she can avoid the hospitalization. So I wasn't reading all these points exactly, but make sure you watch the video a couple of times so that you get the you combine what I am speaking or discussing, and you combine what is in the slides and your experience, and then provide or and then decide a good nursing care plan. All right. And the evaluation is, by the end of the my shift, in Emily experienced comfort and relief as evidenced by her statement. I feel comfortable, much comfortable now. So in the statement, you can exactly quote what the patient has told you. You can also include any of the evidences that you had in the nursing intervention that provided. All right. You can also include the improved vital signs if it is present. So that is what is included in the nursing care plan of anxiety. I hope you have had an idea of it. If you had, make sure you like and subscribe to the channel, and also share it with your colleagues who are interested in enhancing their knowledge, and thereby increasing your confidence and practice as a confident nurse. Thank you so much for watching. Good luck with your career.